Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm your host, Tom Nelson, and I know firsthand as a family caregiver and part of the sandwich generation how tough it can be to take care of your aging parents while balancing your own life, career, and family. We'll bring you the experts and information necessary to help make your life a little bit easier and you a little bit smarter. Synergy Sessions is brought to you by Synergy Home Care, bringing you personalized in-home care and peace of mind to Silicon Valley families. I really do hope you enjoy the show. Everybody, I'm Tom Nelson, host of the Synergy Sessions, Aging Smarter in Silicon Valley. I'm really excited today. We have Eva Peterson, and we're going to be discussing navigating Medicare in many dimensions. Eva is a licensed health and Medicare broker with Health Markets Insurance. She's licensed not only in California, but Nevada, Florida, and soon to be Arizona. She's certified and appointed with over 25 carriers. She's licensed to sell supplemental and life insurance, which includes critical illness, accident, hospital-wise, dental, vision, hearing, travel, and long-term care. Wow, you need to know a lot of stuff. So we started out with the Synergy Sessions. The purpose is to help people age smarter. And I think the first time I talked to you, Eva, about Medicare, I felt really dumb because I thought, like many people, you just flip a switch when you turn 65 or whatever and you get Medicare. But that's not the case. So could you just, first of all, just tell me your role or position in your company and kind of in general what you do, so we could start there and get some context.
Sure. Thanks for having me, Tom. I'm excited to be here. So my role, I'm technically a broker, a health insurance broker. And as you mentioned, I'm licensed in 3, soon to be 4 states and with over 25 different carriers. My role is to assist and guide people in navigating the confusing road to Medicare, as an example, kind of help them understand the ins and outs of Medicare. And as a broker, my job is to make sure that they are aware of things that could affect their premiums, like penalties. I advocate for my clients. I make sure that they know that I'm there to support their best interests. I have no favorite carriers that I work with. My favorite person is the client, so I'm there for the client. So a broker has access to many different carriers, which the client or the Medicare beneficiary, I'm going to say, has access as well. You can go to Medicare.gov and you can see all of this. However, what you won't be able to do is discern between the different plans, why you should pick one over another, why this one, what does this mean, what does that mean? A broker helps you understand and make better informed choices on your Medicare options. And one of the things that people don't know about brokers is that you pay nothing ever. So you're not paying the broker, and the broker is not being paid through an increase in your monthly premium. So it's always in your best interest to use a broker. I have access to software that I can filter quickly and easily, find the best plan for people, and help them understand why it's the best plan for them.
Oh, that's amazing. Because like I said, that in the first 30 seconds of talking to you about this, I realized how ignorant I was about that. And I'm sure most people aren't even thinking about it. So to be able to have someone like yourself just really shed light on, well, first of all, that's kind of one of my next questions, just very basically, what is Medicare? Maybe even different than, right now I have insurance through my employer or whatever. So what is Medicare and how does that work relative to what they're used to or what it is from the government standpoint? Because it is a government, sponsored program.
Basically, Medicare is a federally funded health insurance program that you pay into while you're working. And there are qualifications to get Medicare Part A, for an example, hospital for free. Most people get it for free. And what happens is there's a transition point. When you turn 65, you are no longer technically should no longer be on under 65 health insurance, but there are a lot of different ways to approach this. And I'm specifically talking about Medicare Part A, which covers hospital coverage. Say that you're working and you're going to continue working and you have creditable coverage, and I'm going to say creditable with quotes because it's very important. You have creditable coverage through your employer or through your spouse's employer. When you turn 65, the only real thing you need to change then is to sign up for free Medicare Part A. Okay, so what that does is you still have your employer sponsored coverage, say as an example, or any other creditable coverage, but that Medicare Part A covers any hospital expenses that will happen. So basically, Medicare Part A becomes the first payer. Now, your secondary insurance through your employer or spouse's employer or whatever source, that becomes the second payer. So one of the reasons you would want to get on Medicare Part A and not delay it is because there's a lot of penalties. There's penalties for not enrolling in Part B in time, not enrolling in Part D in time, and this changes every year. These,
Right.
this is a moving target.
Let's go back to that. So Medicare Part A is they become the primary payer.
Yeah.
So what's then the difference between B, C, D, or any or the other
So
components of it?
A is hospital, B
Okay.
is doctor. Medicare Part C is a Medicare Advantage plan, which works with Part A and B, which they all work together. And in Part C, Medicare Advantage, it'll plug the holes that regular traditional Medicare doesn't cover. Dental, vision, hearing. It'll provide like over the counter benefits, most of them, sometimes transportation, gym memberships. It works together with parts A and B and becomes one entity of health insurance. But
And
then
what was D? You mentioned D.
D is prescription drug. So you can think of
Okay.
D as drug. Very important that people know that they need to get Part D prescription drug coverage within 63 days after they lose their previous coverage after they're 65. There are penalties involved if they don't. And what I hear from people is, I'm not on any prescriptions. I don't need prescription drug coverage. Well, that's not true because it may be true in the sense of health wise, you don't need it, but the penalties will be incurred regardless.
Okay. That's really interesting. And I want to dig into that a little bit, but I wanted to check one more thing. So we had talked earlier, and you had mentioned there's something else called supplement. Well, how does Medicare supplement fit into that? Because you had mentioned that sometimes Advantage is a better way to go, supplement may be a better way to go. So what's the difference between the Advantage and the supplement?
So take somebody who's approaching 65, okay?
Mhm.
And say they're no longer working, and so they're going to get on Medicare Part B. They're already on Part A. Um, at that point, once they get on Medicare Part B, then they have two choices. They choose a Medicare Advantage plan or they choose a Medicare Supplement plan. And this is really, really important. And a lot of people miss this, is that when you are over 60, 65 and over and on Medicare Part A and B, you have an initial enrollment period in which you cannot be denied by a Medicare supplement plan, meaning there will be no health question and you're going to get it guaranteed issue, it's called. After that initial enrollment period, they're going to put you through underwriting, ask you health questions, and you may or may not get that plan. The whole reason that you would want to know what a Medicare supplement plan is and why you should consider it when you turn 65 and or are on Medicare A and B is that, and your initial enrollment period, is that Medicare Advantage and Medicare supplement plans cover very differently. Medicare Advantage plans, usually if they're an HMO, will cost $0 a month, and that's great. However, they will have a maximum out of pocket. So if you go to the hospital, there will be thousands of dollars that you will need to pay first before they pay. And that's similar to under 65 health insurance. Maximum out of pocket applies to hospitalization, you know, or that's when it matters the most, is what I'm trying to kind of reiterate. Um,
Right.
so the Medicare Advantage, even though it costs nothing, you've got that maximum out of pocket. You've also got copays when you go to the doctor, when you get any kind of lab tests or services, or go to the emergent care or the emergency room. Okay. So there's that. Now, the Medicare supplement that has a monthly premium. And usually it's pretty low when you first age into Medicare. But what that premium gets you is that supplement plan allows you to go anywhere within the 50 United States that covers Medicare, that takes care. Any doctor, any hospital. So why does this matter? What if I'm traveling a lot after I retire, or my kids are in another state, or I'm living in two places? This would mean that you're not restricted by a network, that you can go to the doctor for any reason, any time. Also, the big thing about these supplement plans, there's no copays ever. There's no maximum out of pocket. If you go to the hospital and you have a $50,000 hospital bill, you're not paying.
Wow. So this is a great segue into the next question. You're starting to already go there. So let's go there. So when you're working with the client, they say like, okay, Eva, I need to think about Medicare. What's your process to identify, what's your process on identifying which plan is right for that person? So they're coming and not knowing anything. How do you guide them? This is, I guess, the Medicare navigation part. Like, so how do you identify the
So
direction you're going to go with them?
the first thing is I feel it's my obligation to inform and educate people on what their choices are. Okay, that's number one, which is let's consider a supplement plan, or let's make sure that you understand the difference. Okay. Then we get into how often do you see the doctor? Are you on any prescriptions? Do you have a medical condition that you're dealing with that you might need a second, third opinion? You need a wider network. What are we dealing with here? What's your lifestyle? Are you traveling a lot? Do you go overseas and travel a lot? Because Medicare supplement plans have some coverage for emergency medical care internationally.
Yeah.
Medicare Advantage does not. So I kind of build a profile of kind of the lifestyle of this person. And then it comes down to budget. So we've got, first of all, we've got health. And one of the critical things that I failed to mention here is, are you dealing with something right now in which you need to stay with your doctors and specialists?
Oh, yeah, right. Yes,
Because if
that's
we're
really
going to
important.
look for a Medicare Advantage plan for you, we need to make sure that those doctors and those specialists and those hospitals are in your network. Otherwise, you have to change your whole team of people. And nobody wants to do that when they've already established relationships for their care. So that's part of it. And then the question is budget. Can you afford a Medicare supplement plan? Medicare supplement plans do not include prescription drug coverage. You have to buy a separate plan. They're usually very inexpensive, but those two, you have to have both. So if we're going to go plan, this direction and go Medicare Advantage, I'm going to really drill down into what are you looking for? Are you looking for over the counter benefits? Do you need transportation to the doctor? Some plans have that depending on what your needs are. Do you want a fitness membership? But for me personally, I will always guide people to notice the maximum out of pocket on a Medicare Advantage. Look at
Right.
that number. Can you afford to do that? Could be 1,000, could be 6,000 every time hospital visit, or if there's one, you know. And
So I was just going to quick, based on that out of pocket. So as you age, you mentioned when you start, it's really reasonable because your probably health risks are much lower. So on a supplement, does the premium go up you say the premium goes up each year,
yeah.
but then also the Advantage plan, does the out of pocket start to go up or does that stay similar? I
Well,
mean,
remember that
I'm a business owner. Health insurance always go up every year.
in some way, shape, or form it does. So we just have to remember that these businesses, they're in it, they're in this for profit. Okay. And they're trying to run this business. So um to answer your question, Medicare supplement plans do go up every year. And this is why, and there some of them are called community rated, some of them are called attained age. So that means like every 5 years, if you're 65, then it won't go up till you're 70 normally, and then 75 if you stay with them, right? Um, and then the community rated is based on usually how many claims or how much money they're putting out in this area that you live in, right? Determines the rate increase. every year I tell people, and this is another reason to have a broker, just because you have a good plan now doesn't mean it's going to be a good plan later.
Or yeah, or even be appropriate for you. So what happens if they did it on their own, they picked the complete wrong program and they came to you, and can they unwind that? Is it one and done? Because you mentioned there's penalties if you don't enroll by a certain point or all these things. And what if you pick and you pick wrong? Is there a way to go back and change
Well,
that or fix it to what's more appropriate
there's
or change it
usually,
over time?
so to answer that question, there usually is a period of time in which you can change your mind, but it's not going to be 6 months or a year. So every year, similar to under 65 open enrollment, there's annual enrollment for Medicare. And this is the time where you get to say, I would like to switch my plan, or at least Medicare Advantage or prescription drug plans. So, MAPDs, which are Medicare Advantage prescription drug plans, they have prescription drug included. You can switch your plan once a year without a qualifying life event or special enrollment, right? Period. You switch it between October and December, and then it's effective January 1st the following year. Then it switches from annual enrollment to open enrollment, which is where you can switch back if you need to. But then once open enrollment is done, and that's usually a few months, in the first few months of the year, that's it. Unless you have a special enrollment period, you move. It has to be a qualifying life thing. You move or your carrier leaves you. People don't know this, but Medicare carriers will send you a notice and say, hey, we're not servicing your area anymore. It's called a service area reduction. When they leave you, you have a special enrollment, which means you have options to choose another plan that's servicing your area. You might be able to get guaranteed issue for a Medicare supplement when they leave you. So, and these special enrollment periods, so I've seen it. This carrier do this, that carrier do that. I mean, in general, moving or having your carrier leave your area and no longer service your area are two that are hands down the norm.
Yeah.
But if you pick a plan and you don't really like it and you wait several months, you're stuck in that plan until annual enrollment.
Okay. So at least once a year, you have a chance to do it. It's not
Yes.
if you screw up in the beginning or your situation changes, you're
Right.
not stuck. You can, but just not anytime you want.
Correct. Because the
Got it.
truth is, I mean, unless you're on Medi-Cal, okay, or Medicaid, then you can switch every month. They just changed that. But the
Oh,
truth is, if everybody was allowed to switch all the time during the year, there would be so much chaos in the health
right.
insurance world. And I think that would be my opinion on based on why that is. But there's one other thing to think about. When I say annual enrollment, that does not apply to med sup plans. So
Say that again. What type of plans?
Medicare supplement plans.
Okay.
Medicare supplement plans. So the state of California and several other states have what's called the birthday rule. And that means every year in and around your birthday, you can switch your Medicare supplement plan to a different carrier as long as it's the same level plan or lower. But during annual enrollment, the only thing, if you're on a med sup plan, you can switch is your prescription drug plan.
Got it. Um, what are some of the misconceptions of Medicare? What are some of the things that people believe that maybe aren't true? Kind of
Um,
like what I said in the beginning, that you just flip the switch and everything was the same. I mean, what?
well, interestingly enough, I'm talking to more and more people every day that are telling me, I thought this was going to be easy. I thought they just enroll me. I thought, this is a smooth transition. It actually is not. So I'm going to tell you a few things that are a little bit shocking. So one, people don't realize they need to sign up for Medicare Part A. Usually they get a letter from Social Security that says you're turning 65. You should enroll in Part A. And usually that makes perfect sense, right? It's free. You can buy your way into Medicare Part A if you don't have enough work credits to get it for free. But most people, for the most part, it's always free. So you need to sign up for Part A. But what people don't understand is that this is a shocker. I mean, Medicare is all about creditable coverage. You must have creditable coverage from another source in order to delay getting on Part B. Well, COBRA is not creditable coverage. So if you lose your job and you get on COBRA and you get on it for sometimes COBRA is like a year to a year and a half sometimes. After 8 months of being on COBRA, you're in penalty zone now. You didn't sign up for a Medicare Part B. And that is not creditable coverage. Find that surprising, but it's very, very true. And people think, well, I'm covered. It's creditable. It was my employer sponsored coverage, but it is not.
Wow.
Yeah.
Okay. Yeah, that who would think that would be the case? So what would be their solution? Would they have to drop Cobra and then get onto an out-of-pocket plan?
They need to get
Or
on
that
Medicare Part B in order to avoid
Mhm,
that penalty. So they would need to drop COBRA, get on Medicare Part B, decide if they want a Medicare Advantage or Medicare Supplemental. That is not required. You're not required to get a Medicare Advantage plan or a Medicare Supplement plan, but you are required to get a prescription drug plan. So,
okay.
but the other big one is that Medicare has a 2-year look back. It's called IRMA, Income Related Monthly Adjustment Amount. That determines your Part B premium. So if you made
Mm,
a lot of money 2 years ago, you're going to pay more than the standard 185 a month for Medicare Part B. Medicare Part B
oh,
plus. And
okay.
you could be paying, I have clients who are paying over $400 now because they're looking back to 2023. As the years go by and your income goes less, of course, that's going to be reduced.
Mm,
If you're not working and you're looking at paying $400 to $500 a month for Medicare Part B, that's a significant cost.
yes.
So a lot
Yeah.
of people don't know about IRMA, it's called.
Yeah, but I mean, if it's a 2-year look back, there's almost nothing you can do about it unless you strategically retire
Exactly.
early or something and then switch over to Medicare. But that might not make financial sense in and of itself. But so that's great because that was a question I was going to ask. Is it based on your income or your financial status, your premium? So it sounds like it is. But you said that it'll go down because let's say they're making a good salary, they retire, but they may or may not have a good nest egg or whatever. And now they're on a Social Security or whatever. They just happen to have a good salary right when they retired. So would that play into it over time of what their current income is?
Yes. So you would just have to wait for your income to your previous income to catch up with reality. Um, but that surprises a lot of people. There's also IRMA for prescription drug plans. So you will pay more. So it's not a penalty. Well, I don't know the right word to use here. It's almost a tax on being in
Yeah,
a higher income bracket.
yeah. No, that, I mean, that makes sense. That's how most everything else is set up. So that makes sense
Yeah.
to have it that way. So you mentioned 65 is when you go on the Medicare, but it seems like there's a lot to consider. So when should, so I'm 58, I've got a little bit of time. So when should I start thinking about, making an appointment with you to start learning about this?
Well, 3 months before your 65th birthday at the very
Mhm.
latest. I have
Yeah.
people that I work with and I go through all of their options, and they're not going to be turning 65 for 6 months. I even spoke with someone the other day, it's going to be 8 months. But the earlier, the better to understand all the ins and outs of it. And what I think the main thing is, what is it going to cost you to be on Medicare Part B, plus possibly a supplement plan, plus a prescription drug plan because you need that? What's it going to cost you monthly, and does that make sense
Right.
versus a Medicare Advantage plan? And so
Right.
before you turn 65, and I'm just going to be honest here, when it's my turn to join the club, I'm going Medicare supplement because
Mhm.
I know the statistics are that even under 65, one of the number one reasons for bankruptcy is medical bills. And these are
Yeah.
people, 80% of those people were fully insured. So what that tells me is the maximum out of pocket. Something unexpected came up, some big medical expense, and they had to choose between paying their daily living bills and paying the medical bill. And of course, you're going to choose your daily living bills. So, kind of getting that foundational understanding of what is Medicare, how do I enroll in it? A lot of people ask me, "Well, where do I go? They get the letter
Is it
and
a website?
yeah, they go, why didn't you tell me? You go to ssa.gov and it'll say there, enroll in Medicare Part A or A and B. But at that point, they don't know if they should enroll in B. Nobody's advising them that, hey, if you have employer sponsored coverage, you don't need to enroll in B. And oh, by the way, you're going to pay for that. So let's really consider this.
Right. And so I wanted to go back to one thing you had mentioned as far as what was it, a regional reduction?
Oh,
What you
service
like
area
what?
reduction. Yeah.
Yes. So, and I would imagine that would be more related to the advantage because one of the things that I've always been aware of, the advantage is usually attached to an HMO or a medical,
Yep.
provider. So you have Kaiser Advantage or Blue Cross or Blue Shield or, United Health or whatever it is. So it seems like the advantage piece, and that's what maybe people should understand is the advantage isn't just Medicare Advantage. Doesn't it attach now to a provider? How does that
A network. You're
work? Okay,
attached to a
network.
network. Now, the truth is you can get a PPO, a Medicare Advantage PPO plan. They will charge you. It's about like $40 to $50 a month, right? And before it was like 25. And you will be able to go outside your network. However, you
Mhm.
will pay differently. Lately it's becoming apparent that PPO sounds great, but you're going to pay very differently than if you went in network. So, yes, you can go out, but you're going to pay for that. And yes, you're right. Medicare Advantage plans. Here's a perfect example. Stanford decided last year or the year before and last year, we're not going to deal with Medicare Advantage plans anymore. We're just not going to. So we had all these people that were getting specialty care from Stanford doctors, Stanford doctors' offices, facilities that are like, oh no, what am I going to do? Where am I?
Right.
Now I need to find new doctors. And they had been these doctors for a long time.
Mhm.
So at
With
that
that, sorry, go ahead.
Oh, okay. At that point, there's a conversation. What are the options? Do you want to switch to another Medicare Advantage plan, knowing that you're not going to be able to go to Stanford anymore because they're not taking any of them? Or is this the time to see if we can get on a supplement?
Right. That was going to be my question. Would that qualify as a qualifying event? Like
Yeah,
my normal doctor is now
yeah,
not taking my insurance.
yeah,
So can I now I switch over to supplement?
yep.
Okay, that's great. Because I was thinking on the front end of this, let's say, so I'm currently a Kaiser member. If I like my doctor at Kaiser and the only way I can use Kaiser is to get on an Advantage plan, is that true? That would be how I would get on that network, that HMO network. So that would be another, besides the cost, that would be if you liked your doctor in a certain network for Advantage, especially Kaiser or something that's exclusive,
Mhm.
you have to be in their system to use their doctors.
Right.
Yeah.
And I just wanted to mention, because I didn't mention it before, Kaiser won't let any agents or brokers sell their plans. You have to go directly through Kaiser. And I have
Oh,
worked with many people that ended up staying with Kaiser, and that's fine. But they
mhm.
come to me, we do an assessment, we say, here's your options. And I educate and inform them on what their choices are, and they choose Kaiser, and that's fine.
Oh, yeah,
It's whatever works for the client, right? I'm not here to convince somebody to go this way or that way. I'm here to and help them make the best decision based on their specific needs, and every single person is different.
yeah, absolutely. Making that informed decision is the most important thing. I think you helping them not have that, moment after they made the wrong decision. That's fantastic. So I think you talked a little bit about it, but maybe remind everybody a little bit, what is the difference between working with a broker versus just self-enrollment. And I was even liking this to, I just went through a home sale process. My realtor, all the ins and outs, versus me trying to do that. Is it, or like working with a lawyer to try to like do some legal proceedings? What is the biggest advantage to work with the broker other than just going to the website and kind of trying to figure out yourself?
I think it's peace of mind. I think it's knowing that you have somebody that you can rely on that's looking out for your best interests and that knows what they're talking about.
Right.
Because Medicare sales is highly regulated. We have to retrain every single year with every single carrier and to sell Medicare in general every single year. So things change. People think, like I said earlier, that once you're on a plan, you're good. No, you should be checking every single year with a broker. Are you on the right plan now? What? Because things change. Here's a perfect example. Last year, this year in 2025, they implemented the Inflation Reduction Act for prescriptions. So what that meant is that prior to this year, if you had very expensive prescriptions, and you'd be surprised, a lot of people do, you could pay up to $8,000 out of your pocket before they're covered at 100% per year. The Inflation Reduction Act, they reduced that to 2,000, and that's great. Okay. But what do you think the companies did? The carriers, they're in this for profit. They're trying to run a business. Well, what happened is we saw prescription drug plans change. We saw prescription drug deductibles go higher. We saw for the first time in several years prescriptions not being covered on their formulary. They were covered before. We saw different prices for coverage for prescriptions. And there were changes, and we saw increases in premiums.
Okay.
So, yeah, this is something that unless you were paying attention, you wouldn't know. And if you weren't in the business, you wouldn't realize. But one of the biggest things, too, I can offer as a broker and I'm basically an advisor, is that I get people come to me and they say, I got on this great inexpensive prescription drug plan. It's 47 a month. It's amazing. And then I say, okay, let's load up your prescriptions. And then I go, you're not on the good plan, and here's why. You're going to pay thousands of dollars out of your pocket for that inexpensive plan.
Right.
This is the plan.
Okay. Wow. So you have a tool that you can actually put in the prescriptions that they have right now and just look at what the outcome is. How much are they going to pay? Is it more than now, or what's the best?
Yep.
That's super helpful. Wow.
Yeah,
That's amazing.
I can filter by which plan is going to cost you the least amount of money out of pocket. So if you're not looking for the least expensive plan in a prescription drug plan, you're looking for the total estimated cost based on the prescriptions that you're on and the dosage and the milligrams and so on. How much are you looking to spend if you stay on these prescriptions for the whole year? And this could be very costly. And you might want a plan that's a lot more premium a month because overall the estimated cost is going to be much lower. And I've seen it $100 lower, $1,000 lower, 2,000. I mean, it could be significant.
Right. Absolutely. Wow. But is there anything else that we didn't talk about that you think is important for people to know? I think we covered a lot of ground, but I want to make sure if there was something else that people aren't aware of that might be helpful to steer them in the right direction or something to think about.
Well, I think, find out as much information you can from somebody you trust and is in the business. And to me, the relationship is the most important. Sometimes you don't gel with somebody, and that's okay. You are not obligated when you seek advice from a broker or an agent. You're not obligated to enroll with them. You can, get a consultation with one broker and see how that, if anything sticks there. But you can also go to another one and do the same thing. And you'll know when it's a match, when you feel comfortable, because the relationship with your broker, it goes on long after you're enrolled. Because this is a relationship where I call you up prior to annual enrollment and say, have an appointment. Let's double check your prescriptions. Let's see how your plan's working for you. And then if you're on the best plan still, that's great. Well, it's not, but you're not going to get that from somebody that's working for just one carrier. I mean, their job is to inform and educate you on that specific plan, and that's what they do. But you don't have anybody looking out for you.
No, that makes sense. And being proactive like that, as you mentioned, they get that one chance every year to re-enroll and to make sure that it's still appropriate for their needs. That's fantastic. So there's a couple of things. One, I'm going to have all your contact information and how to reach you. But is there anything special about, like, if somebody wants to engage your services, how do they do that? Do they just do they reach out to you and then you set up an initial consultation? And then, as you mentioned when we spoke earlier, that, if they're outside of the state that you are licensed in, they can still use the information you help them, and maybe you can point them to somebody in that area, or give them some direction there too. So how would that work if somebody said, "Oh my gosh, I got to call Eva," or how does that whole process work?
Well, firstly, you can contact me at any time. It doesn't matter if we're in open enrollment. It doesn't matter if you're ready to switch. If you have questions and you need information, reach out. You can call me, you can text me, you can email me, and I will set up a time for us to review your information. And it doesn't even take that long. So that's one way. But also, I wanted to reiterate that, I'm licensed in California, Nevada, Florida, and soon to be Arizona. But I work with people all the time. I just talked to a guy yesterday in North Carolina, and he's a friend of a friend. And I helped him get on the right track. And then I told him what to do next. And I said, if you can't find a broker, or I can't find a broker for you, we can go on Medicare.gov and I'll help you do this. So the question then would be, why do I do this? Because even though he lives in North Carolina, I've helped him. He had a good experience. He has friends, neighbors, colleagues, and family that live in other places and might need my assistance or guidance. And I'm here to guide people and help them. So I'm happy to do that at any time. So it doesn't matter to me where someone lives. I'm ready to help. And I believe that what you get, you get what you give. And I think it comes back to you.
Yeah, absolutely. Well, that was one of the biggest reasons I wanted to have you on, because when we spoke, and then even yesterday when we were chatting about what we were going to talk about, we went for a whole hour because you're passionate about what you do. I mean, in my business, same thing. We don't do this type of work if you don't have a fire for it and helping people. And I love that authenticity. So just wanted to say, thank you so much for being on and to answering the questions. I have a feeling this is going to go much more beyond your 4 states. And so to be able to actually help people and get them on the right track, again, I'll make sure we have all of your contact information, all the notes and links to whatever is appropriate. And I'm definitely convinced this is going to help a lot of people. Thank you so much for being on Synergy Sessions today, Eva. And thanks everybody for listening. And don't hesitate to reach out to Eva. She's looking forward to helping you.
Thank you for joining us on the Synergy Sessions. We know you have a lot on your plate, so we really appreciate you spending the time with us today. If you found the information in this episode useful, please reach out to the guest or the resources in the show notes. I know they would appreciate it and would love to help. Also, if you have an idea for a future episode, please reach out to us on Instagram or Facebook, or email us and let us know. We'd love to hear from you and provide information that's useful. Lastly, please remember, you don't have to do this alone.